This segment is going to be hearing from three of our judges from across the state. Judge David Sweat, from now Senior Superior Court Judge from the Western Circuit in Athens Park County, Judge Penny Freeseman from the Eastern Circuit in Savannah, and Judge D. Downs, who's now Senior Superior Court Judge here from the Atlanta Circuit in Fulton. And the comment I want to make about this, and we touched on this, Judge Leifman and Dr. Benson touched on this earlier, and that I mentioned it when I stood up, is that, you know, just because you don't have a mental health court in your jurisdiction, if you do, great. If you don't, if you'd like to have one, Judge Brenda Weaver's here, she'd love to recruit you. But even if you don't, there are some innovative things that can be done. And so these three presentations are all from judges who have or continue to preside over mental health courts in their jurisdiction, either started the programs or continue to preside over the programs. But the presentations they're about to give you are not purely about mental health court. They're about other innovations that their jurisdiction have come up with sort of as a spinoff or as an adjunct to what they were doing in the mental health court arena. So what we're going to do, we're going to have each of them come up and do a brief presentation, and then we're going to take, I think, a few minutes at the end for sort of a Q&A, maybe let everybody come up and try to facilitate some questions and answers. So let me introduce first to you Judge David Sweat Matthews.
Thank you, Judge Goss. And I'm going to try and do this in 15 minutes. We take about 30 people in our mental health court. There are more than 30 people in Athens Park County with severe persistent mental illness. At one point, I just got frustrated and I called the director of the community service board in our community and said, let's get together and talk. And we started to get together to talk, and we started to talk about what we could do. And I'm going to tell you that you have the power to do something, because you can get people in the same room at the same time. You have, if people return your calls, you don't have a turf that's going to threaten other people. You're viewed as a neutral player, and you're already talking to many of the people. But you don't talk to them at the same time. So in 2014, I've got some donuts. I got people to come to 8 o'clock meetings from all the relevant sort of institutions you think about. Also, I think it was important we got our hospitals involved. And hospitals are spending a lot of money on folks that have a mental illness. They're spending a lot of money on people that are only going to be there 72 hours before they're released, that they're just holding. They want to talk to. The EMS service, they spend a lot of money rolling their EMS team to events where there is a mental health crisis. They would like to not do that because they don't get paid. And of course, there are already mental health providers. Benchmark was at the time the crisis response team in our community. I think it's changed. But the big partners was Advantage Behavioral Health, our community service board. If you don't know your community service board director, make a meeting and start talking to them, because that's, you can get people together. We got together, and this is what we figured out. You got to figure out where you're at. This is where we were at. Does that look like the sequential intercept model to you? No, it is not. And so but you have to figure out where you're at, because there's so many different places that they're interacting and they're not talking to each other. And so you've got to start getting people together so they can talk. They enjoy it. They find out they've got a lot in common with talking about the same people, and they have the same goals. So first, we got together we're fortunate in Athens, we have a resource-rich environment, but whenever I talk about this, I always think about Joe Bishop in the Petula Circuit, where there is one traffic light. So I'm trying to think of what you, if you are in a rural jurisdiction or small jurisdiction, can do, and you can get people together and start trying to figure out what is possible. Of course, we had a mental health court, but that was not really addressing everything, and mental health court was one of the very narrow parts of what we were hoping to accomplish. And once they're arrested, you're in trouble. You started the train of judicial intervention, and you want to get people before they get arrested. So we figured out kind of what it was, and then of course, these are the program outcomes everybody wants. I mean, we all want to do these things. This is what we started out. It helped us get a grant that we had met, that we had everybody in the room, everybody supported it, and we got a planning grant for community diversion. We've been looked at different models, made a trip to Kansas for a field trip to their co-responder model out there in Lawrence, Kansas. And we were clarifying what it is that we wanted to do. And these were kind of our goals. And the next thing we did is we needed some data. The CSB, our Advantage Behavioral Health, they had somebody that went out to the jail and spent hours and days and several weeks or more looking to match individuals who've been in the jail with their clients who had been served at the community mental health system. And we actually did two studies. The first one was when we were just getting started, and then we went back again in 17, and we got the same results. The data did not change that much. And we were able to do it because you've got all these HIPAA issues, but since we had an Advantage person doing it, and we were using aggregate data, we kind of probably skirted around some of the thorny HIPAA issues that you can get into. And we were developing a memorandum of understanding so that we're all kind of partners in the data sharing. So this is what we found out. That's how many people were in our jail that we believed had a mental health diagnosis. The length of stay, 22 days, and the rate of return, and then the ones that are connected to service. I got this slide and I took it to our county commission, and I said, this is what we're dealing with. We need to get going to try, it's costing you dollars. They understand dollars. So this is the kind of my favorite slide that I showed to them. Average length of stay from their client, from Advantage clients to the non-Advantage clients, it's about 3 times as long. And you've got the lifetime arrest, the average number of arrests, and the frequency of return to jail. So very persuasive type information for the commission. Then this was a study that we did. I didn't do very much. I'm gonna tell you, I didn't do very much. I called a meeting, and there were a lot of people that were willing to work, and I just sort of stood around. But this, they did a focus of 250 of the Advantage clients that were compared to a larger group. And if you look at this, you have court-ordered release because they don't have a bond. They stay in jail until the judge decides, okay, we've held them long enough, we're going to let them go. So you're going to have more court-ordered releases amongst this group of people. They're not going to post bond at the same rate as they expected. This was all statistically significant. They're going to be released on their recognizance. They're going to serve a sentence, and they're more likely to go to prison. That's the data for this population of, we've selected 250 folks to look at compared to the overall group. So what did we do? We had seen what is called the co-responder model, which is being implemented, San Antonio model it's sometimes referred to, where you have a clinician and responding with a police officer. Now, I should have gone backwards with this. Athens has almost 100% of their officers CIT trained. And we have, in fact, our team has developed, their team, those folks, developed an advanced CIT training because the police officers wanted more of it. They really got a lot out of it, and they wanted more of it. And so we have a senior police officer, a mental health officer. This is a clinician from our CSB, and they are our co-responder team. And of course, they go to, for one thing, it's a day job. I mean, it's their day job to do this, which I think is real important. And getting the money to do that, we got it from a grant. But our commission is now funding a second team, and they're picking up the team that was funded by the grant. So if they start seeing some results, it can help you with that. They review the reports daily to look for individuals who may have been clients or receiving services from the CSB. And so this gets tricky because, again, you've got HIPAA, but you've got the LCSW, who is the employee by advantage, looking at this. And so she can take information that might suggest that an individual is beginning to experience symptoms of a mental health crisis and get that to the clinician who may be rendering services. Hey, here's a heads up. There was a police citizen encounter. Doesn't have to be an arrest because they look at all of the reports, and now of course our officers are much more in tune to, is this a mental health issue for this individual? That brings about them doing the follow-ups, and it even kind of goes the other way. I don't know if this is legal or not, but the clinicians. Okay, wait, is this meeting is sometimes the clinicians know to go and check on somebody.
Sometimes it's better to ask for permission than for
forgiveness
than permission.
But sometimes the police know to get asked to go check on somebody, and it's a welfare kind of thing. So but that's the rationale. It's maybe a welfare check, and sometimes there's an opportunity to urge or arrange someone who may need treatment to connect them back to treatment before the carts in the ditch. And it's really that's really bad. We looked at. This is a great guy. Personality is important. You need the right people. He figured out that there were all of these police reports. He reviewed 17,000 of them. Found about 7% that involved mental health, but there was 636 of them that we identified as being consumers with mental health services in our community, and they accounted for some huge number of the arrests amongst that group. Of course, we began the increased officer training, and as I had mentioned, we started doing community training because there are so many people in your community who are interacting or likely to interact with individuals who may be in a mental health crisis. And what is the average layperson feel about someone that's having a mental health crisis? It scares them. It just scares them. So clerks of hotels, we've done this twice with the mental health first aid, and they will get people and train them about how do you respond? I mean, what do you identify? What's going on, and how do you respond? And so that's, I think, is the thing that may, I want us to keep doing that because I think we can have more people that are informed about mental illness, and work on the assistance that comes from the civilians. Of course, we're trying to do the trauma-informed, and we have a trauma-informed library. I don't know exactly what that is, but but I think there are a lot of institutions that are trying to become trauma-informed. And again, we've got many more traffic lights than they do in the Portillo circuit, and we've got a lot of wonderful people. But there are a lot of these things you can do without a whole lot of money. These are the topics in CIT training. I know when we've been on a conversation with sheriffs the first time back in November, sheriffs all over the state are saying, we don't have the money to take somebody and send them for a week to get trained. But the converse of that is, what is it going to save you? We're going to have to get the folks in a lot of different jurisdictions convinced that this is something that will save them money. And then these are, as much as our hope for outcomes were, and we're still, doing the numbers and evaluating, is that we had some real good process outcomes where we got agreements with people that formally didn't talk, that agreed they would, how they would operate, and data sharing. I think the data sharing with particularly with the hospitals and the mental health providers, the CSB, has been helpful in trying to connect people to treatment. We're very fortunate in Athens. About the time that we were having the conversations, starting this back in 2014, the director of the CSB, they were looking to purchase a building that was a former psychiatric hospital in our community, and it became their main facility. And we have a 28-bed crisis stabilization unit. We have a 24-hour clinic that someone who's in crisis can walk in and will most likely see a peer counselor. And then there's sort of a 23-hour admit where somebody just needs to get calmed down. And this is a place that when law enforcement recognize they may be encountering someone that they might be able to lead them to, even if there's not a criminal law violation. So what are the takeaways? You have to find some people that are willing to do it. And Judge Liefman is an excellent example of that. And you got to get the people together. You got to start collaborating, and you got to start counting, because data is what drives decisions. You start dropping some data on the commission, they're going to start paying attention to the sheriff. Everybody starts seeing the value of this. But I think you have to find what works in your community, because we're very fortunate. I've always felt like I was fortunate to live in Athens, but in recent years, I guess it'd be even more so seeing what people are willing to work together and accomplish. Thank you.
What we're going to do, there's an hour for this session, so we're going to do about 15 minutes, 15 minutes, 15 minutes, and then bring all three back up for 15 minutes worth of questions and answers at the end. A couple of comments I want to make, because Judge Sweat was mentioning about Judge Joe Bishop and Judge Ernest and Judge Balcom and the Tall Circuit, which is my neighbor circuit in Southwest Georgia. 7 counties, 100+ miles from one end of the circuit to the other. Cumulative population of the 7 counties, 48,000 people. Cumulative population. Yet they have figured out a way to deliver services in an extraordinarily rural setting. So, if you're in a smaller jurisdiction, you say, well, we can't do this. Sometimes you have to be a little creative, but it's doable. One other thing I want to mention in that regard, we've heard a lot about crisis intervention training. All of you are familiar with GIPSTIC, which is the acronym, for Georgia Public Safety Training Center there in Forsyth. They will actually bring CIT training to your jurisdiction. If you're interested, if you'll call, you can just call the front desk and say, I need to talk to somebody about CIT. They'll put you in touch. There are different coordinators for different regions in the state. And pretty much, if you'll guarantee them, I I think it's a dozen officers, and it may be 3 or 4 jurisdictions partner together. You'll give them 12 attendees and a place to have the meeting, they'll bring it to you. So if you're interested in that, reach out to Gypstick there in Forsyth and tell them that's what you want. They'll put you in touch with the folks to do it. So with that, we're now going to turn it over to Judge Penny Freeseman from Savannah to talk about some programming they've got going.
Thank you. I do not have a PowerPoint. Before I get started, I wanted to echo something that I've been hearing here when we were talking about trying to do things innovatively and things like that. Something happened today at this seminar that got me thinking it was a perfect example. I've been a judge on the bench now for 25 years. I think that's a quarter of a century. And as I've been seeing all the mental health problems and things, I've been reading about how you can explain it to people, explain what it's like to have voices in your head, that people have gone to these seminars and there's really fancy equipment and things like that, put on headphones and all that sort of thing, and that will give you a feel for what it's like. And I keep thinking, I want to go do that. Well, this morning, Judge Lightman, you took the people out, brought people in, and did something, and I didn't bring my little slip of paper, but what I ended up doing on mine after Judge Mumford kept screaming in my ear, and I got for nothing a perfect window into exactly what we're talking about, and it didn't cost anything. And so there are so many things that we're always trying to come up with a really expensive way to do stuff, and it's not always necessary. Anyway, so I've been asked to talk about 2 things that are happening in Chatham County and at Savannah. I also understand, Judge Lightman, that you love Savannah. Savannah's kind of like a fun place, so anybody who wants to come visit or has any ideas and want to come help us, please show up. We're on the coast. But I've been asked to talk about 2 things that have gone on in Chatham County, and one of them is jail accreditation that I'm going to talk about for a couple of minutes, and the other one is our felony competency docket. And understand that as it happens, I was asked to talk about 2 things over which neither of them can I take any credit. For the ideas I can take no credit for at all. As far as the jail accreditation, I can't even take any credit for the implementation of that. In fact, I had to Google a little bit of it to understand some of what was going on in our jail. As to the competency issue, our competency docket, I can claim very little for that either, because I stood on the shoulders of a couple other people, Judge Goss and Judge Gosling, who had done that. I'm almost a little nervous talking about it in front of you guys, because I've probably gone off on some little tangent, and I'll hear about that later about some But in any event, as to the accreditation, it's the NCCHC accreditation for Chatham County Jail, and that stands for the National Commission on Correctional Health Care. And Chatham County happens to have to be the first, as I understand it, jail in the country to have dual certification with that organization for both regular physical health and for mental health. As I understand it, and this was the part I had to Google to understand a little bit more about it, NCCH dates back to the early 1970s when the American Medical Association did a study of jails, and shock of shock, it's different now, of course, but they found that the jails were had inadequate, disorganized healthcare services and a lack of national standards. And so in collaboration with some other organizations, they eventually resulted in the organization of the NCCHC, which is a not-for-profit 501c3, and their early mission was to evaluate and develop policies and programs in the areas of healthcare. And eventually, this started off really just dealing with physical health care, and fast forward to now, and the NCCHC is also now doing mental health accreditation as well. So our jail, under the leadership of our sheriff, is the first facility in the country to be dual certified. There's lots of them that will have one or the other, but we happen to have certification of both. And the question really is why, what difference does it make? Why am I standing up here and talking about it? And this is what I can tell you, that the main reason that this accreditation has been so important for us is as you know, the populations have exploded in the jails. Nobody knows what to do with them. Nobody knows exactly how to handle it. we're the least, the least equipped. You spend half the morning talking about that, and we all realize that's the problem. So having a set of standards gave our detention center sort of a roadmap or just a place to start. Because it is so discombobulated and there's so many things going on. So it gave them a roadmap and gives them a continuing roadmap on how to organize, how to plan, how to staff, how to train, to understand what to even ask for when they are not only going to the county commission to ask for money, but also how to design and what to ask for in the health contracts that they were doing. What is it that they're even looking for? And there turned out to be like no experts really the county has all these people that do the contracts and do all the work, and shock of shocks, there really was no experts in what should be in a contract. And so the contract was that same mumbo jumbo that nobody really knew what was in it, what they were asking for, and what they needed. So for us, what it has done is it has just upped the game of our jail. It's added a level of professionalism, and so it's made a difference. Now, our jail is a long way from being, it's not a jail that I would say, please come and see everything here is done, done correctly, because it is not. We have, I'm embarrassed to say, a jail population of today 1,850 people, and we have about 300,000 people in Chatham County, so we're big. We cycle through about 16,000, I know, compared to Miami, we've already done that. We've actually spent some time this week with some of his colleagues from Miami, and I've already kicked myself and realized that. We cycle through about 16,000 people a year through that jail, many of them not staying for very long. I understand there's about 500 in there with mental health issues. There's, on any given day, 2 to 5, it happens to be 3 today, who have such severe mental health issues that the jail really doesn't even exactly know what to do with them and doesn't have the care for them. There's about 40 in our mental health ward, 5 to 10 every on any given day that are on suicide watch. So we still have a long way to go. But one of the things that happened, just as an example, was that the jail has been really spearheaded a SAMHSA grant that we just got, or that we got, that brought down, that's how your colleagues ended up in Savannah this week. And we spent 2 days, again, with the leadership of the jail. It was actually at the detention center, and they helped us I helped get some of the people in the room, but they helped get everybody together on this thing, and hosted a group where we mapped out the healthcare, mental health system in Chatham County, came up with some priorities, and are trying to conform with those priorities now. Those priorities turned out to be things as basic as trying to identify, making sure that we've got the right tool that we're using to identify people when they come in. I was looking to see, so it's early identification of people with mental health issues and things like that. It's going to be one of ours, actually getting a better CIT program. We've got some CIT trained officers, but trying to up that both in the jail and out in the community is another one. So I'm really excited about it. And from that group, one of our big decisions was we were going to Miami. So we're coming to Miami at some point.
After January, you'll be much happier.
Okay. That's true. Yeah, that's true. I'm not stupid enough to go there in the summer. I already live on the coast. I know better. To switch gears now for a second and talk to you about the other matter that we have going on, and that is the competency docket. And what I preside over is the competency docket for the felony competency cases, or I might also call it a forensic docket. Whatever you call it, it's really just a management system to try to deal with it. What we found out was that, well, let me tell you what happened. First of all, we're finished up about our 4th year of it now, and we started it back in March of 2015 is when we instituted it. There are 6 Superior Court judges in Savannah, and we were all doing our own thing with it. Whatever cases came in front of you is what came in front of you. So our first big thing, we had a great court administrator, so we have a whole policy that we've got set up and everything on how to do it. And all of them now come in front of the competency judge. They all go, we don't call it a court, we call it a docket, because it never changes the assignment. It always stays with whichever one of the 6 judges that has the case. But it leaves their caseload for the time being, and it comes onto our docket for us to take care of it. I handle it, we meet once a month. If I can't be there, one of my colleagues can sit in on it instead. We have an assigned district attorney, and we have an assigned public defender as well. Now, we see a lot of private attorneys. They usually gum up the works because they don't exactly know how to do it, but we have them as well coming through. And I sign all orders for competency evaluation, so if there's a request, we have a form, or the form that we use. We have specific questions that we ask, and I don't look at it real closely. I flashback it a little just to make sure there's enough. Again, sometimes I have to send it back, particularly to private attorneys, to give the Georgia Regional Doc something to work with, so that they know what they're looking for. But we'll do that. We meet, and then actually our public defender also takes a look at the ones that are coming through her office. So she already has sent them back. So usually if her initials on the bottom of it, I just sign it and off we go. We meet once a month, and we handle most of the hearings that we're going to have to handle that morning. And what that means is that the Georgia Regional Docs, for the most part, only have to come to the Chatham County Courthouse once a month instead of coming and dancing to the tune of 6 different Superior Court judges. I've thought about how to handle it in Judge Bishop's district or something when you're a little further away from things, and much of what we do there's probably a way to think about doing it with video. Maybe a way to be able to get the doctors together, because a lot of it is their testimony. Once the forensic is completed, it comes back to my office, and I will send it immediately to defense counsel. We have a lot of form orders that we use. I have also one of the staff attorneys. Another thing we're very blessed about that, and I have a staff attorney. I have my own staff attorney, but there also happens to be one that sort of roams the courts and does all 6 of us. And so one of her jobs is the competency docket, and so she'll get these orders out really, really quickly. So when a report comes in, we'll send it off, and we'll seal the rest of it, and then the defense lawyer has to make a choice about what they're going to do. If they're going to, if they look at it and they agree with the opinion that the person is competent to stand trial, then we'll have a little form, and we will send it right back to the judge's case it is. If they're incompetent, or if they think so, then we'll start the process of having a hearing, which will usually happen within the next 30 days. We'll get that done as very quickly as we can, so it happens pretty quickly. So we're handling that first thing in the morning, and then we also, later on that morning, we're also dealing with those cases that are under court supervision, either because they were found incompetent and non-restorable, or because they were found in GRI. We're also watching those, and that stays on that competency docket the whole time. I will tell you that when we first put this together, the hardest thing was figuring out what those cases were. What were those cases that actually were supposed to be under court supervision? The person who didn't go to trial for murder, for example, and they're supposed to be under court supervision, and no one had talked or knew anything about them 4 or 5 years had gone by, that sort of thing. So we had to get it from about 18,000 different sources to figure out just what cases we actually had that needed to be under supervision still. And so we got all those together. That took several months before we were confident that we had them all. We keep a lot of statistics on the information that we've got going on. These stats that I have were good as of a year ago. We haven't done this last year. So what I have basically is the 38 months before we started the docket, and the first 38 months after we started the docket. Because one of the things I was interested in is, it just seemed like we were doing a lot, and so the question was, if we build it, will they come, and were there more people that were asking for them just to sort of cover themselves, and were there too many of them being asked for? And what we were finding was that in the 38 months before, there were exactly 100 evaluations, 26 of them with findings of incompetency to stand trial, which was 26%. And in the 38 months after, there were 182, so that's what's more, the number had doubled, but there were 42 found IST, and took me a calculator to do it, but that's 23%. So we're in the same neighborhood, so that worked out well. The biggest difference that we saw, and this is what we went in there the first thing to do, and that was the number of days from the forensic order, so the order that I signed asking Georgia Regional to step in until that first Georgia Regional evaluation. In the first 6 months of the competency document being up and running, it took an average of 169 days for that to happen. That's how long it was. And that really, if you look back further, it could be 8-9 months, someone sitting in the jail waiting for an evaluation, but it was 169 days for that first 6 months. In the last 6 months, again, this is a little old, but in the last 6 months when we did this, it was an average of 34 days. And I think when we look at our numbers, we're going to be at that number, if not even quicker than that, because we've really got their buy-in now, and they're paying attention to us. On the not so good side, so this gives us a chance to look at where we need to go next with this, and that what hasn't changed is from the date of arrest to the date of that first order, and that has been in the during the first 38 months of the competency docket. It's an average of 301 days before somebody has the bright idea to ask for there to be an evaluation to begin with, and that's a problem. And that's part of that identification and figuring out who's sitting in the jail. And it's like you talk to the jail, they know there's problems, or the counselors will know there's problems, but nobody's communicating. It looked like that picture that you put up there with all that stuff. Also, the number of days from the actual finding of restoration or whatever may happen to get them back to their court, from that day to the first hearing and to getting them through the system also has not has remained stagnant. So we're trying to get that moving along quickly too, so that once we know what we've got, we can move them through the system a little more quickly. And I think that, and then we have a lot of form orders and things like that, like I've said too, that sort of speed things along. And anybody who wants any of that, I can share a lot of that with you as well. And that is our 2 issues. Thank you.
Let me say, of course, we're down to 4 state hospitals now. We have one here in Metro, Georgia Regional, East Regional there in Savannah, one in Columbus, and one in Augusta. And so, for those of us in the other parts of the state, it really emphasizes the need to be consistent and have a policy and a procedure for handling these cases, not only so that we keep up with who's in the jail that needs to go to the hospital, who's at the hospital that needs to come back to jail, but it's important to our sheriffs. The transports, the strain on the county budgets is significant. So, as you mentioned, like a lot of times we'll have doctors come from Savannah, and people say, well, that's South Georgia. Well, it's 255 miles from the hospital in Savannah to Albany. And not only do we have to transport patients to and from, but when the doctors have to come testify, they want to make one trip instead of multiple trips. So if you're struggling with that in your jurisdiction, do reach out to Judge Gosselin, does it in Gainesville, I know, and Judge Freeseman, or you can call me. But it really is helpful to be more efficient and to have more consistency in handling these cases. I'm now calling Judge D. Downs from Fulton Superior Court to share some thoughts with us about your stepping up grant.
Hello, everybody. I'm here to talk to you all about our Step Up grant. It is really an exciting thing. I know those of you in rural areas think that what happens in Fulton County isn't going to apply to you. But I'll tell you, if you multiply the problems you have on the number of people we have, you'll find that it's really, really hard for us to get our hands around problems in the big city. And this is our effort to do so. We got a Bureau of Justice Assistance grant in 2016. It's called the Stepping Up Grant. And The goals that Judge Sweat put up, many of them are the goals of that grant. The first is to reduce the number of people with mental illness booked into the jail. So that's number one. Shorten the average length of stay for people with mental illness in the jail. That's a huge problem. Everybody knows nobody bonds out somebody that is incompetent or in crisis. They want to stabilize before they bond them out. And so they sit, even for very small offenses, they sit. Increase the percentage of connection to care for people with mental illness in the jail. I don't know about your jails, but it's very difficult to connect to care in our jail. And we have one psychiatrist, one, in our whole Fulton County jail, and there's huge numbers of people in crisis in that jail. And we want to lower the rates of recidivism. That is the key. So I recognize so many faces here today. I feel like I've been on my soapbox for so many years. I was a prosecutor for 14 years in Fulton County before I became a judge in 1996. So for 36 years I have been in the Fulton County justice system. And I am a strong, passionate believer that you cannot punish your way into a safer society. You've got to make common sense decisions. You've got to find out what the problem is and spend the least amount of money and the most amount of sense, common sense, resolving it. So that's what we're trying to do with this Step Up grant. We received in 2016 $250,000. And what that gave us was wonderful. I'm just telling you, it was the answer for a minute. We had the Carl Vinson Institute of Government to come and help us, which is really what we needed. And as David Sweat said, they made me in charge, I guess, because I could pull people in. And so I am the chair, and I still am as a senior judge. I went senior at the end on October 31st, Halloween. That's appropriate for me. So I went senior, and now really I have more time to dedicate to this. And since then, I have spent a lot of time doing the things I don't have time to do when I'm on the bench trying murder cases. But at any rate, I want to go over with you, we had a phenomenal task force, and I was amazed that at the very first meeting, huge numbers of people from Atlanta came. I mean, it wasn't just Fulton County. We got APD, we got 911 folks, we got all kind of folks from Atlanta showed up. We had folks from other parts of the county police departments came. Fulton County came, Sheriff's Office came, jail folks came, mental health folks came, doctors came. It was amazing, the group that showed up. And we did the sequential intercept that you were talking about, Judge Freeseman, and it looked crazy to me, but I'm just sitting there and watching it all go down, and I was amazed at the things I learned that day, having been in the system for 36 years. So we mapped it all out, and then we got the groups to meet weekly. And then we as a task force met monthly, and still the task force kept showing up. We had 60 to 100 people every time we met almost as a task force, which blew me away that we had that many dedicated people, because these are people with full-time jobs that are overwhelmed just like I was. And they don't have any time to do this. And they're all in there saying, we've got to make a difference, this is unacceptable. And so what did we come up with? We came up with the top 5 priorities. What they did was put sheets of all, I don't know, how many did we come up with, Holly? About 50 things we wanted to do.
The sequential intercept mapping was fewer, but at the final end of the task force, it was
a huge number.
132.
And they gave us all a sticky. And they told us to go put our sticky in the one we thought was the most important. And so everybody's running all over that room with their stickies. And we came up with the 5 top. And so the 5 top included a misdemeanor mental health court. And the misdemeanor mental health court, Chief Judge Kirk's here still, she was here, good. She is championing that court, and we all backed her 100%, and it is going. And is Judge Porter here as well? Oh, good, Judge Porter, I hadn't seen you yet. How you doing? She's doing it as well. So state court judge and chief of the magistrate court came together for this misdemeanor mental health, and it is funded, it went pilot, and now it's permanent, right? So we're very excited, and that's huge. We sort of had that, and we all loved it. It was called TDC, Treatment Diversion Court, but when we changed, we don't have a CSB. All these rural areas telling me about the CSB, and I said, where's ours? We don't have one. Fulton County is the only county that doesn't have one. So getting state money is a different avenue for us. But at any rate, we got these 5 top things, and our TDC turned into a legitimate collaboration of a mental health court for the misdemeanor. I have been the drug court, mental health court, vet court judge ever since 2002 in Fulton Superior. And we divided it up into courts in 2011. So I am now still the behavioral health treatment court, looking forward to turn it over to a new judge that is active now this month, so that's exciting. But the things that we came up with, our first business case, jail screening and re-entry, what we learned was that I had never understood why all these people that are getting their primary care for mental health through the jail aren't identified. When they're cycling through, well, it turns out that every time you put another contract with a new help group at the jail, the old one takes off with all the information. And so we start over again. Then the person who's been there 50 million times is now a stranger to the person. And so that, I could not believe that, but that's what happens. And so the first thing and priority is to stop that. And it's to screen everybody who comes through the jail. Because I can't even tell you what percentage of people in the Fulton County Jail suffer from mental illness. Because we don't have an adequate screen, but now we're going to have one. And we went through this process, you all, with the county manager attending. He came just about every time, which was also phenomenal. And so he bought in to the work that this task force did. And when we asked for $491,537 for jail screening and re-entry, he said yes. And he put that money in DBHDD budget, so it's not in Superior Court budget. They're going to hire 2 supervisors, and River Edge, who is doing our county mental health, is going to supply the other folks. But the money is there for the screeners, and that should start in June. So we're very excited about that. We have a correctional mental health screen for men and for women. This is a validated screen that is going to be used. We're hoping that NAFCARE, who is the medical care for our judge, our jail, will ask this 90-second questionnaire. They're right now resisting, thinking that we're somehow coming in and taking over some part, but we're hoping they will, because fewer people touching people, asking questions is better. And so we're hoping they will do that. And then if the 90-second screen turns into a bigger screen, and we will have the screeners. So these are the correctional mental health screen for men and women. We hope the rest of the state will use, because these were selected by the medical folks on our task force. They recommended this. This would make our state uniform. We would all be talking the same language, and so that's something that we really highly recommend. We also, that's going to help us tremendously. Number 2, let's just go on to data, because I need to get through it all. Data, the critical part about data, we're not trying to share HIPAA information. What we're trying to solve is the fact that we have individuals that come into our jail that have been touched by multiple mental health, housing, all kinds of organizations that could give us information about these people, and we don't have any idea. where that information is or whether they've had touch with them. So this data that we want to build will tell us that this person was treated at Georgia Regional. This person saw River Edge. This person saw, so that we know where to go to get the information if we're trying to make a plan for this person. And of course, re-entry should start at entry into the jail. That is the big goal also. We need to start working on that re-entry the minute they enter. And so we want to include initially Fulton County Jail, Grady Hospital, Fulton County DBHDD, and the Homeless Management Information System, HMIS. We'd like to know if they've had contacts. This is right now going to be sort of a county thing. It should turn more into a state and county thing eventually. So if they've been in South Georgia at one of your treatment persons, and that's where their family is, and that's where everybody that knows them is, and support system, that we can call and find out what's going on, and try to make a plan that works. Training, CIT training is critical, and I'm very envious, Judge Sweat, that you say that all of your people are CIT trained. We have a huge turnover of people. There's no way we're going to have everybody CIT trained in a year, in 2 years, but we are starting with Fulton County and APD. 911 operators will be trained, and for this effort, we asked for $100,000, and we got it. So if you get organized, and we did these business plans. Carl Benson helped us get these beautiful business plans, and we'll share it with anybody that would like to see it, but it is, lays it all out there so that you can get the funding. You've got to back it up with numbers, like Judge Sweat said, and this was an extreme help for us. Then we've got, the final one is the Diversion Center. We went to Louisville, Kentucky, I believe is where we went, and saw something called, I didn't go to these places, I just listened, and they have something called the living room. And the living room in Louisville is a concept that we want to implement, and it sounds like you've implemented something like that in Athens, which is a place to take people who really just need a moment. You know, they just need to calm down. They just need to get through the day or get through the night. And the living room has peer support there. They have peer support, and they have sort of an ability to triage, in that if you're homeless and you need help, they can refer to you to homeless services. You know, they have the ability to refer out to services. It is not a place to spend the night. It's not a place to eat lunch. It is a place to sit and be quiet. And a place for drop-off for police officers that don't know what to do with you. And so in order to just get you away from where you are, they end up locking you up for trespass or just coming up with something. And it turns into an obstruction, which turns into a terroristic threat, you know, and you end up with a big case which didn't need to happen. So that's what we're looking for, the location now. The city of Atlanta, I believe, is going to contribute $800,000, and Fulton County is going to contribute $800,000. So we've got some funds. Now we need a location that makes sense. We're not covering the whole county. We're covering the city, basically. The urban part of the city will be covered by that, so that the police officers can get right back into action. Right now, it takes a long time to go take somebody to jail. You know, you've got to have a report, you've got to have a charge, you've got to have, it takes time. And it doesn't take nearly as much time to just drive by a living room and drop somebody off. So that will be an incentive for them to do something like that. So we've got money for that as well. You know, we in the city, sometimes it also feels hopeless to us. I mean, it just feels so big, and the problem is so, and Judge Sweat is real important in his area, but I'm a nobody in my area, you know, and I've been here for 36 years. I can walk in my courthouse and they might still frisk me. I've been waiting to become a judge for years, you know. But it's a big, big place, and there's just a lot of people. And so it's a lot to get your hands around, and sometimes I dream of going to an area where there's just a few people, You know, we can all get in a room and solve a problem. But then what we do have in Fulton County are these unbelievably committed people that have met in this task force over and over and over. And I just want to thank Judge Belton came to so many from the juvenile court, Judge Porter, Judge Kirk. I mean, the judges who never show up. They showed up. It was amazing. You know, we judges, we can't help much, but all we can do is support, because we're at the end of the line. We're at that sort of hopeless end of the line where it's all just prison, prison, prison. Or why has this person been in jail for 3 years waiting for a trial? You know, it just feels broken. So there are exciting fixes. We need a competency court in Fulton County. Though I'm a senior judge, I'm going to really advocate for that, because I don't know how we never find our cases either with 20 judges, but they need to be found and they need to be organized. So that's something we could do. But thank you all so much, and I would
We're going to now open it up for a few minutes for questions for these judges about what they've discussed or anything else. Let me urge you, you know, you've heard Judge Lyman talk about convening a meeting. Some of the other judges talking about convening a meeting. I refer to that as a HUN meeting. Does anybody know what a HUN meeting is? Judges, what's the first 3 letters in front of your first name? H-O-N is HUN. Not honey. There you go. That's not like a telephone. Catch more flies with honey than vinegar, you know. But you know, sometimes you do. You have to get people in your community in a room and think about who all has a piece of this issue. You mentioned our general medical. Not all of us have you know, advanced psychiatric crisis centers in our communities, but pretty much everybody's got a small county hospital, maybe with an emergency room. Well, they've got a piece of that because these folks are landing in crisis in the emergency rooms at high dollar cost to the indigent fund for the county. The sheriffs certainly have an interest in this because of their responsibilities for transports to the jails. But the other piece you got to think about is not just the traditional treatment people and the clinical criminal justice folks. Give some thought to the psychosocial issues. And when we talk about psychosocial issues, we're talking about those issues that are neither medical nor legal. It's not just they have schizophrenia. It's not just that they have a terroristic threats charge. It's they don't have anywhere to live. Or they don't have any transportation to get to whatever appointment you might make for them. So when we talk about psychosocial factors, that's really where the rubber meets the road with a lot of these folks. Housing, transportation, you know, appropriate clothing in the winter months. You know, a lot of our folks literally are what they got on. That's what they got. And so, you know, be thinking about that. Sometimes you got to cast the net a little wider to bring people in your community. But there are a lot of people, you know, with different organizations that are working with this same population, just not in a coordinated fashion. So, any questions for our panelists? About it? Any questions, period? Yes, ma'am.
I'll support a person that works with women in transition from sex work. And I went to a play, I think last year, and there was a play called Part4-Judicial, and it was about a prostitution court. And I was coming here to get some information about how to help the women avoid, you know, going back and forth into the life back on the street and stuff like that. Because when they're homeless, they are engaged in prostitution or they go to strip clubs and stuff like that. So I was wanting to know, because of the psychosocial, that's kind of the psychosocial side. If anybody have any ideas or interest in addressing that issue, because you know, in Atlanta being like a sex trafficking place, and even you in Savannah, like being on the coast, like all that kind of character stuff, like what are we doing to help these women who are kind of like in a cycle, and the stigma is crazy.
I'm not familiar with whether we have a prostitution court in Georgia. Some of the other judges. I know this, ma'am. In DeKalb, okay. So you may, or is that the program you work with, or?
No, I've heard of that. But because Atlanta is so, you know, concentrated with the urban thing, like she just brought to my attention that a lot of the issues are mental illness type basis, the reason they're targeted, the reason that they keep going to it. So like, is there any way we could, or anybody here would think about how to help them instead of just labeling them? And if they come in contact with a prostitute, there are other things like the man was talking about, being abused sexually, like so much stuff goes on with them. I just wanted to bring that up.
Sure.
That was a question.
You know, as Judge Leifman mentioned earlier, and I know Dr. Vinson touched on it also, you know, one of the things those of us who've been working in this field for a number of years, we never talked about trauma. The first 10 years I was doing this, I never heard it mentioned. And, you know, then we started, you know, finding out more about the research. A lot of it was driven by the Veterans Administration with our vets returning from Iraq and Afghanistan. And I think we're just wiping the tip of the iceberg. I mean, the more we learn, the more we know, the more we now know what we don't know. And, you know, there's been a huge study that's called the ACEs study, the Adverse Child Experiences Study, which was a joint effort of Kaiser Permanente and the Centers for Disease Control, where they sample 17,000 people that they've been following now over an arc of years. And what it's showing is that children that have high exposure to trauma as children, there is a high correlation to them developing behavioral health and addictive disease issues in adulthood. You know, we're just learning more every day, but I really do. I think the whole topic of trauma, we're going to find out over the arc of the next 10 or 15 years, those of us who are in the court system, just how prevalent it is for the population we deal with. And it's not so much the whole topic of what's wrong with you, it's what happened to you. You know, and it frames it not as a moral failing or as a moral shortcoming, but as that person might have been victimized at an earlier point in their lives.
Thanks, can I?
Yeah, Judge Sweat.
I think that we may be at sort of a watershed time in responding to mental illness in the criminal justice system. I think there may be more money out there because money is one of the things that you feel like you need. So getting partnerships together so that you can be ready to do that. I think we just happen to be lucky that we were there when the BJA announced the grant. But I think there's a lot more of that, and some of the governor's money I don't know how that's going to get spent. Somebody else may know more about that. But I think we're at a good time to be doing this.
Yes, ma'am.
Is there any push or any kind of coordinated effort to make this statewide or nationwide rather than each community doing its own separate thing? And I ask that question because, for example, I'm a municipal court judge, and my community, my city is 12,000 people, right? And so there's not a word here that I disagree with, and that I would love to be able to do everything I'm doing, but it's not going to happen. And I don't have the resources. My city council and the authorities in my community are vehemently opposed to this sort of thing. They are not into any kind of alternative, anything they can pound hard on anybody who violates any kind of law. It's not going to happen on that scale. And even if it could, even if they were on my side, you scale it down. The city of Miami, which is huge, has these 97 people, which cycling through, you scale it down to the size of my city, you've got 3 people, and I can name them, and I know who they are. But to create an entire system for those 3 people is efficient. So it just for the economy of scale, it would make more sense to coordinate resources throughout a larger jurisdiction, which is not something, and because, like the judge said, where you see these people are on little offenses, like the shopping carts and the things like that, and municipal court judges are the ones who see them. But we're the ones who can't get it done because we're in little cities of 10,000 or less people, and we're all part-time. I work 1 day a week as a judge and 4 days a week as a lawyer. So I don't have the time or the resources to do this. So there has to be some kind of coordinated effort bigger than my little community. And so is there any kind of coordinated effort on a statewide level or a national level to make this happen?
I just have a question. Do you have an accountability court in your jurisdiction?
We have a mental health court in our superior court.
Have you thought about partnering with your superior court and accountability court?
We can't really. Well, for a lot of the offenses, we can. City ordinance cannot be transferred to superior court.
Just in terms of resources, they have teams, they have case managers, they have counselors, they have people that perhaps you could refer some of these folks to.
That would require cooperation with the district attorney's office, which is not especially well.
Cooperation is key.
It would have to come from somewhere outside my community, given the personality and temperament of the actors.
Let me say this. The very first mental health courts, like in the late 1990s, Judge Winston Buffalo, had a court, the DeKalb Magistrate Court. The very first ones anywhere in the country were all typically municipal court, first appearance court type programs that were all what I refer to as front end programs. People coming in from who got arrested yesterday and link them to whatever services you could put together. That's not the model we have for accountability courts in Georgia. Ours is more of a post-plea. People are on probation or on deferred sentencing because we're focused on the high-risk, high-need offenders trying to make the greatest impact on the prison population. So is there a huge need for what you're talking about? Absolutely. The only thing I can suggest to you is you've got 3 offenders who are your frequent, revolving door kind of folks. You might just have to cobble together what you can and try to use it in a more coordinated fashion. I think a lot of us who've been doing it before we did the huge lift and Governor Deal and the legislature got behind us and said we're going to do this statewide and take it to statewide scale. There were a lot of programs like in Gainesville and Judge Weaver and the Appalachian Circuit and different places. We were doing good things, but we're all doing it on a local level. And it was just a function of whatever we could cobble together locally. So that may be what you have to do, if you're in a municipal court setting and are not getting a lot of cooperation otherwise.
Can I just make one comment? Let's not forget that your local community service board is your safety net provider. And so you should be going to them if you're having these issues to seek your assistance. Because they're the Department of Behavioral Health and Developmental Disability. They represent them, and that's who's supposed to be providing these services at the local level. And if we don't demand for them to provide these services, they're not going to.
Yes, ma'am?
I just wanted to comment on that. First off, my name is Stephanie McGruder, and I'm a current employee with the Council of Superior Court Judges. But part of my background, I've did constituent services for the Georgia Department of Behavioral Health for 5 years, and I'm the former board liaison with the Georgia Department of Behavioral Health. And what I just advise anybody, get to know your key players in the state of Georgia. And the top key player is the Georgia Department of Behavioral Health. You can always call their constituent services number, whether it's for a consumer or whether it's for a family member. You can reach out to them either by phone, email, and it goes right to the commissioner's office. And it's been key in me having to work with families who have, individuals who have behavioral health diagnosis. And, you know, it's just been, you know, my lifeline to stay connected. There are a lot of things that are taking place. Not only are they doing the peer certified specialists to kind of help specifically in rural counties also, but I just did a training with the Department of Behavioral Health last month where they're now creating forensic peers. They're being certified through Georgia Mental Health Consumer Network to help persons who are coming out of the prison system who are going to be transitioning back in the community, and so that they're not, you know, part of that recidivism, but will have services once they come back home. So get to know your key players. The community, I believe there are 26, 27 community service boards across the state of Georgia. There are 10 crisis stabilization units, and you know, there's something else you all mentioned about the CIT training officers. There are agencies that will send those out. I think Georgia Bureau of Investigation has a team that will send out to train also. You know, so just get to know your key players across the state of Georgia. One other thing that I heard, I came across a family who reached out to me because they had a loved one who was in a jail system, but that loved one refused to tell anybody that they had severe mental illness and was being offered a plea that was, you know, a lot, I thought, but who am I? But at any rate, I said, well, did your family member let anybody know in the jail that they have a mental illness? What about their lawyer, their public defender? They refuse to say anything about having a mental illness. So, you know, I'd love to one day see something that, you know, if it doesn't violate HIPAA, that's something that says, we got to arrest, this person has a mental illness, they're in court, you know, something of that sort. So that's just my concern.
All right, let's do this again. Thank our panelists for being here today.